Good afternoon. I'm Janet Papadakos, and I'm presenting today on behalf of my co-investigator, Dr. Meredith Giuliani. And we'd like to thank you for your support of our work. So just a little background to refresh your memory of the proposal. Informal caregivers of cancer patients are central members of the cancer care team, and they're important for delivering high-quality cancer care. Despite this important role that caregivers play, they receive little to no direct support or training, and caregiver responsibilities continue to increase. And a number of important publications have advocated and encouraged the development of programs to support caregivers. We know that the burden of caregiving is not equally felt among all individuals, all caregivers. Caregiver burden is disproportionately higher among certain groups in the population, including elderly caregivers, Black and Hispanic caregivers, women, and caregivers with lower socioeconomic status. Our team published a paper last year. It was the results of a literature review that we did, that we wanted to look at the education and training programs out there for cancer caregivers and really have a good understanding of what the curricula was, how the programs were delivered, and who participated in them. And what we found was a very small number of caregiver programs that were aimed at skill building, and the vast majority of the programs that did exist were focused almost entirely on psychological well-being, and they didn't address the holistic needs of caregivers. Also, most of the programs required in-person attendance in a specific time at a specific place, and of course that has limits to who can attend and who can participate. So this is the objective of the grant that we had submitted and that you funded. We wanted to obtain a holistic understanding of the essential caregiver education and training needs that they needed so that we could develop a course ourselves. And so we employed a mixed methodology. We did some qualitative interviews with caregivers and also conducted a qualitative cross-sectional needs assessment study. Part of the needs assessment was also to develop a questionnaire and to validate it. So the results of our study we had shared with you in a previous report, so I won't go into great detail here, but we developed the survey and we evaluated it for face validity. We conducted the cross-sectional study and the interviews to inform the course architecture, so how the course would be accessed, how it would look, and also the curriculum within it. And the results have been used to support other grant applications. So we have received funding from other organizations as a result of the data we collected through this grant. And the Caregiver Education and Support Program launched in the fall last year, and there's a picture of it here, and you can check it out at pmcaregiver.ca. And currently, we did receive funding to develop to evaluate this course under a Phase 2 evaluation. The abstract for this qualitative component of this work is presented actually today by Mohammed Ugas from our team, and manuscripts are under preparation. And I just want to quickly say thank you very much for your support, and also to let you know that we were able to leverage the work through the AACE Reads grant to obtain other opportunities as well. So thank you very much, greatly appreciated.